Thank you, Dr. Priyanka Singh, and those who attend the Hindi session.
Thank you, sir.
Good evening, good afternoon, and good morning. This is the 2164th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Urmila Bulgaria. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, doctors, and students. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again and subscribe the same without paying any money. The purpose of the forum is to take homeopathy to every home around the world. And as you all know, we have already uploaded more than 3,950 videos in YouTube. So those who missed the session can watch it again at YouTube by searching IFPH Homeopathy. And now let me come to today's guest. As you all know, today our guest is Dr. Urmila Bulgaria. And she is the Associate Professor and PG Guide, Department of Practice of Medicine, LR Homeopathy Medical College, and she's the postgraduate guide. And she is the physician and researcher, New Life Homeopathy Clinic. Today, Dr. will be discussing about Beyond Hormones, the art of science of the whole women healing. Last time, Dr. has taken another session, and that was a brilliant session. So we welcome the guest of the day, Dr. Urmila Bulgaria. Doctor, if you there, kindly open the video. Beyond Hormone, the art and science of whole woman.
So, Dr. Urmila, actually, she is my student and she is working there at LRSA Homeopathic Medical College. The topic which she has selected, that is a philosophical topic. And again, sir, you repeated the name, the title of the topic, please.
Sir, it is Beyond Hormone. That is the art and science of whole woman healing. So
Yes, sir. So, art and science, we know that art is the skill to get a result, and science is the base of that art. So, no art can be possible without the base, that is science. So, systematic study of the existence of nature, that is science, and when the science expressed by means of art. So, homeopathic system of treatment is both science and art. The science part is our natural law, that is similia similibus curanter, and the art part is case taking. So a homeopathic physician must be potential with the knowledge of art, science, and practice of medicine. Then only the homeopathic physician can practice radically and rationally. For example, a case where there is obvious cause. So obvious cause means the causes to which the patient does not want to confess. So the cause which is related to sexual matter, the cause which is related to suicide, poisoning. So these causes are not expressed by the patient easily. So the physician should be artistic and has to take the confidence of the patient, and if he or he will take the confidence and ask question privately, then only the patient will express, because if you not know the obvious cause, then it is not possible to select the medicine. For example, the obvious cause is bad effect of insult. One of my patient, he was a clerk and he had 3 children. They are girls and they are grown up. So the clerk is of 35 years. So what happened, the wife of that clerk always suggest her husband not to do any type of conduct which is not suitable to the kids. One day what happens, unknowingly she hugged the wife in front of the child, and because of that the wife scold the person, and the person feel insulted. So because of insult, what happens, from the next day he suffered from impotency, and that patient came to my clinic. When the patient came, before that there are 2 to 3 patients were there. They were present. After that the patient did not come to me. So when I call him, then the patient came and he requested me to discuss with me privately, because one of my student, Dr. Chakresh Jain, he was present. So because of that he told me that he want to consult me privately. Then what happened, I explained him that he is a doctor. Though he is a student, but he is a doctor. You can express any problem without any hesitation, and it is my guarantee that your problem will be not exposed. Then the patient told everything, the story, what was happening with him. He has been insulted. Because of insult, the problem arises. Immediately, my student who had seated there, he told that, sir, the medicine is Staphysagrea. Immediately, without taking any time. So I agree with him, and as the symptom was very prominent, that's why we prescribe higher potency of Staphysagrea 10 mg. So 1 dose Staphysagrea 10 mg, and I prescribe nihilinum, that means placebo, twice a day. So after 3 days, the patient came with a sweet box, and that sweet box is not for me. That sweet box is for that Chakresh Jain, and he was so happy. I can't express. So this is homeopathy. So, and the cause is obvious. The patient expressed his complaint when he was asking privately, taking the confidence. So that is art part of homeopathy. Again, there are so many cases are there where the skill, the patient need to be developed to collect the symptom, to elicit the symptom, to provide the correct remedy. Another example I am giving, that another patient of mine, he was suffering from fear. Severe fear is there, and she was fearing, and even when his parents, they offered medicine to her, the patient was not taking that medicine with a fear that he is being poisoned. So fear of being poisoned, we are having so many medicines. There is a medicine that is Rostox, another medicine Hyoscyamus. When he was being offered the medicine, the patient was scared, and the patient was leaving that place and went to a corner of the house and hid herself. So I think that the medicine, as she is a grown-up child, so I think that Hyoscyamus is the suitable medicine for her. And when the mental symptoms are very precise and accurate, and the susceptibility is high, then we need to prescribe higher potency. Because the susceptibility is high, the symptoms are precise. In potency selection, we have already studied about Jhar's conception and Stuart-Close modification. So Jhar has already mentioned that during the proving, when you prove medicine and started from mother tincture and go upward, then what happens? The symptoms will get common to uncommon. For example, we will prove medicine on healthy human being, the mother tincture potency 3, 6, 30 like this. So we will get common symptom first, then when we will go ahead, that means in dynamic form, then only we will get uncommon symptoms. So Jhars has advised that when the symptoms are very prominent and the symptoms are uncommon, then we have to prescribe higher potency. So in that case, Hyoscyamus 1m was prescribed. When I prescribe Hyoscyamus 1m, then placebo. So after 3 days, again she came with her parents, and the patient was very jolly, and the fear was completely removed. So that is the miracle of homeopathy. So if we select the medicine properly, and then it will help. So we have having the skill, that is to elicit the symptoms skillfully. Second, another case I am telling, that a patient, he was an income tax officer. He is from Gwalior. So when I was practicing there at Raipur, the patient came to me. He was residing just nearby my clinic, and he came with a complaint that I am suffering from insomnia, and my sleep is disturbing, not because of any cause, because of my snoring. See, that patient was snored in such a loud voice that his snoring disturbed the sleep of himself. Though the sleep of others were disturbing, but he himself could not able to sleep because of the loud voice of his snoring. And I go through the repertory, and I found that one single medicine, that is opium, which was very suitable. And though opium, I had having the potency 201 m. So as the symptoms were very clear, I prescribed 1 dose of opium and placebo. So after few days, again the patient came, and he told that now the snoring was reducing, and he is able to sleep a sound sleep. So when we will get a single medicine under single rubric, in Kent's philosophy, whatever report you may follow, then that act miracle, it is miracle. Miraculously it acts. That's why I have noted all from the repertory, that is Kent's repertory, manual repertory, all the rubric having single medicine. Another case I am telling, his wife was suffering from recurrence boil. That boil was appearing surrounding the anus again and again. So when the boil was appearing surrounding anus, then I went to the repertory and found only one medicine, that is capsicum. So capsicum in Kent repertory, will get capsicum when the boil appears surrounding the anus. Then I prescribe capsicum, and I get a miracle result in that case. So what Dr. Umila was going to present, that is art and science. So every homeopathic physician must be artistic. If he will be artistic, then he can able to practice unprejudicedly. Otherwise, he will be prejudiced. So again, another thing, before some days in our IFPH, the cases of pediatric was presented. So in pediatric cases, what happens? The symptoms which are expressed, which are collected, that is the subjective symptoms are very less. The child, they can't express the subjective symptoms. So we have to observe there. We have to observe the what I am telling, the attitude, the behavior of the child, and when we observe with observation, we have to select medicine. That is also an art. For example, the child who is in the with the parents, if the child is rubbing the nose in the shoulder of the mother, then we have to think about that the child is suffering from worm problem, and Sina may be the medicine. If the child is suffering from worm infestation, and the child is again and again showing the navel region as the painful region, then we have to think about roundworm infestation, and we can prescribe spigelia like medicine to get relief. So this is the skill or art part of the homeopathy which is needed. That's why a good physician must be artistic and able to elicit the signs and symptoms of the patient, by which the medicine can be selected perfectly. Where there is the gross pathological changes is there, that is something different. But where the disease in functional level, and where Sora is playing the major role, and the mental symptoms are very clear, in those cases we need to develop, we have to skillful to collect or elicit the symptom. I am giving another example of a case that is a chronic case, that is a rheumatic arthritic case, and we know that these are the autoimmune disorder. There is no medicine in conventional system, only they prescribe the painkiller, that is non-steroid anti-inflammatory painkiller. They are having no medicine at all, and the C-reactive protein of that patient was high, and it is a clear-cut case of rheumatic arthritis. So in that case, what I observed, that patient who was coming to me since a long time, in spite of my repeated request that since a long time you are under my treatment, but you are not getting complete relief, so you please, I am sending to you a physician who is more potential, you go there and treat there. In spite of that, the patient did not want to change the physician. That means he told that whatever situation may happen, I will show to you, please you select the medicine. So I had gone through the repertory, that is synthetic repertory. In synthetic repertory, it has been clearly mentioned that if the patient has having a overconfidence with the doctor and don't want to take any medicine from anywhere else, and he has a good faith, then Silesia is the medicine. So Silesia is a medicine, though whatever may be the pathology. Actually in homeopathy we have having the dynamic medicine, so we need to believe on dynamicity, because every disease, whatever we are observing nowadays, they are psychosomatic in nature. That means the disease, they appear in psychic, and when it is not properly treated, properly dealt, then the psychic things suppress and it appears in physical sphere. So when a case will come to you, we have to be cautious, and we have to go for the history. And if the history is suppression, that means mental suppression is there. Simple thing we have studied in Mathemedica, in chamomilla. Chamomilla is a very good medicine for child. So chamomilla, diarrhea occurs because anger and indignation of the mother. That means when the mother becomes angry, then it causes diarrhea. So just you see, so there is no pathological relation, but because of the anger of the mother, the child is suffering from diarrhea. So this is the miracle of our homeopathy. So we need to be skillful. Second thing, regarding potency selection, we need the skill. We know that higher the age is inversely proportional to potency. That means when the age increases, the potency has to be decreased. So this is the general rule, but the physician must be artistic, and he should know that there is a contradiction. What is the contradiction? In developing stage, that means when the development starts, at that time this rule is not applicable. For example, a girl of 9 years and a girl of 12 years. The girl of 9 years, though the age is less than 12 years, but in 12 years the girl is in puberty stage. So in puberty, the new hormones are secreted, that is a developing stage. So in that developing stage, we have to select higher potency because the susceptibility in comparison to the 9 years girl is more. So this rule is not applicable. So here, as the patient is in developing stage, so we need to prescribe higher potency to get a result. Same example I am giving, that in dentitional age, in 9 months the tooth it starts. So a girl, a child of 3 months and a child of 9 months, the 9 months susceptibility will be more. Same thing it happens during pregnancy. So in pregnancy, new hormones secreted, and that is the sensitive, that the lady is sensitive and the susceptibility is high. So a lady, when she is pregnant, the susceptibility remains high. So we should not do any mistake, and we have to give higher potency to get a good result. Again, one patient of ours in our hospital, an old man of 80 years, when I took the case, the man was very active, and actively he was answering, and everything he was doing perfectly. So in that case, we have to select the potency skillfully, because if the person is active, the vitality is strong enough, then we have to select higher potency. So this skill we need to develop as a homeopathic physician. And Hahnemann has already mentioned. Second thing, in fourth aphorism, Dr. Hahnemann has already written that he is likewise a preserver of health if he knows what is to be removed when the person is in health. That means he should know about the prevention, how to prevent the disease. So this is also skill. This skill must be developed, because as per prevention is concerned, our medicine, we are prescribing preventive medicine, prophylactic medicine, like conventional medicine, but they are having special program, they are having immunization program, and they are prescribing the medicine to prevent certain diseases like DPT. They are prescribing, they are giving DPT, polio to polio vaccination to prevent the communicable diseases. So, but in homeopathy we differ. How? We have already studied. Burnett has written, because of the overdose of the vaccines, it causes a disease that is called vaccinosis. So we have our system, though it is at one, we are agree with the immunization program, but what they are telling, that 2 drops of polio is sufficient, is to be distributed to all the children. We know that 5 fingers are not equal. So 5 children, they cannot be equal. They are having no equal sensitivity. So the polio vaccine, though the dose is minute, but the dose must not be same for all child. So this causes bad effect of vaccination. We are having so many medicines for bad effect of vaccination, like Silicea, like Thuja. So when there is bad effect of vaccination and it creates hindrance in the path of cure, then this type of medicine we need to prescribe to remove the hindrance and to get a result. So that skill we need to develop. Second thing, the science part of homeopathy, that is the totality of symptom is the science, the case taking is art. Why totality of symptom is science? In 153 aphorism, Dr. Hahnemann has mentioned that to promote the totality, we need to collect uncommon, peculiar, rare, indistinct and characteristic symptoms. So uncommon, peculiar, rare, indistinct or characteristic symptoms are required to promote the totality. So totality of symptom, which has been mentioned in aphorism number 7, what Hahnemann told, that totality of symptoms, these are the outwardly reflected picture of the internal essence of the disease. So those totality of symptoms are sole guide to select the medicine. But what it must contain? It must contain the uncommon peculiar symptoms. If it will not contain the uncommon peculiar symptom, then whatever medicine will select, that is wrong. So to promote the totality of symptoms, every homeopathic physician should have thorough knowledge about perception, about conception. So regarding perception, Dr. Hahnemann has written in aphorism number 3. So what he has written, the physician has to perceive what is to be cured in the disease. So whether we have to consider the outcome or we have to consider the beginning, because every beginning is imperceptible, every beginning is qualitative. So we must think about the qualitative. A person if he is suffering from any disease, so we have to see about the beginning. I am giving example. For example, that a person is suffering from diarrhea which is yellowish bland in color, and the person is thirstlessness, there is changeability in diarrhea. That is the outcome. But if the diarrhea is due to night watching, that is the cause. If the diarrhea is because of night watching and taking spicy food, then you have to think about nox vomica. So this is the thing that we must have to know. So that's why Dr. Stuart Close has written in his topic, that is the what I am telling, that is law of causation. So law of causation means every effect has not only single cause, there are so many causes, and an artistic physician has to be find out the real cause, and accordingly if he will prescribe the medicine, he will get the result. For example, a patient suffering from dysphagia or difficulty in deglutition after taking fish. So when he took fish, what happens? One of the piece of the fish, it lodge inside the throat and it causes dysphagia. So that fish bone is the maintaining cause. So the physician must have the knowledge about classification of the disease, what has been written by Hahnemann between the aphorism 72 to 80. So here the maintaining cause is the main cause. If you remove the maintaining cause, then the disease which is called pseudochronic disease can be permanently cured. So if the physician is able to understand about these things, then he can able to treat judiciously and rationally. Second thing, if he has thorough knowledge about diagnosis, then only he can differentiate between common symptom and uncommon symptom. So common symptom, uncommon symptom helps us to frame out the totality. I am giving an example. In Sorainum asthma is ameliorated by lying down. So when the patient is getting or lying down, he gets relief, because in asthma what happens, the diaphragm, when you lie down, it comes towards the chest, so it pressure, so the patient feels worse. So in most of the asthma, that's why when the patient is suffering from breathlessness, wheezing, then what he does, the patient feels better when he sits. What we have observed in hyacinthus, arsenic, drosera, other corallium rubrum. So these are Aralia racemosa. So these are different medicine for asthma which are ameliorated when the patient sit, but when he lying down, then it aggravates. So but in Sorainum, this contradiction we are getting. In Sorainum, what happens? The asthma or breathlessness, it is ameliorated while lying down. So when the physician see it, immediately he thinks about Sorainum and try to administer. But a physician who has having scientific knowledge, he should think that the amelioration which the patient is getting after lying down may be because of anemia. If the patient is suffering from anemia, then the patient will feel better when lying down. So that is a common symptom. So if it is common symptom and we will prescribe Sorainum, then we are doing mistake. So Sorainum is not the indicated medicine there, because that is a common symptom of asthma. Same example I am giving, that in case of Merksal, in Merksal there is a charismatic symptom that the patient passes more water than intake. That means if the patient will take 1 glass of water, he will passes 1.5 glass of water. So that is a characteristic symptom of Marksal. So if the physician will prescribe basing on that symptom, then he may do mistake. So he should be unprejudiced and he should know about the ADH problem. That means antidiuretic hormone deficiency. If there will be antidiuretic hormone deficiency there, the patient will suffer from diabetes insipidus. That means in distal convoluted tubule, what happens? The antidiuretic hormone which is secreted, it helps for water absorption, and ADH is secreted from posterior pituitary. So from posterior pituitary, 2 hormones are secreted, that is ADH and oxytocin. Oxytocin, that hormone helps for contraction, and ADH helps, that antidiuretic hormone helps what? That is absorption water in distal convoluted tubule. So when there is deficiency of ADH, what happens? The water cannot be absorbed in distal convoluted tubule. When the water cannot be absorbed from distal convoluted tubule, then the patient usually passes more water. And considering this, if we prescribe Marksal, we are doing mistake. So we need to differentiate between common symptom and uncommon symptom. So the knowledge of science, that means knowledge of disease in particular and knowledge of disease in individual is required. So knowledge of disease in particular we are getting from other allied science, that is our gynecology, surgery, medicine. But knowledge of disease in individual, that is gained by homeopathic philosophy. I am giving example. 5 persons, they are suffering from fever. So all are suffering from fever, and all are having Widal positive. So Widal positive means they are suffering from typhoid fever. The medicine in allopathic side, nowadays, in previously they were prescribing chloramphenicol, and now paraxin and other higher antibiotic is prescribed. But in homeopathy, though all the 5 persons they are suffering from typhoid fever, the Widal test is positive, but what we need to do, our medicine differ from person to person, because one is thirsty, another is thirstless. One is restless, another feels quiet and feels better in quiet position. So on the basis of individualization, we have to differentiate one patient to another patient, though they are suffering from same disease. So that knowledge in which our homeopathic is based on, our homeopathic is based on the concept of individualization, the concept of dynamization, the concept of holistic concept. So these things we should not forget. So we homeopath need to remember that our approach must be holistic. We should not treat any part, any organ, any system, because no organ, no part can exist separately. All the organs, all the parts of our body, they unite together and perform the duty in healthy condition. So when the organs, part, they do their duty as a unit in healthy condition, how can they suffer in disease condition separately? It is not possible. So though one part is suffering, the other parts they compensate. For example, there is a pain in wrist. So yes, the symptoms it appears in the wrist, but our mind cannot employ for higher purposes because of pain. So all the parts they unitely suffer. That's why holistic approach is highly essential, and on the basis of holistic approach, if we select a medicine, then the highest ideal cure, that is restoration, is possible. But if we treat considering the part or organ, then definitely it will palliate, it cannot cure. So when a person is suffering from synovitis and they are giving anti-inflammatory drugs. So we should not give any anti-inflammatory medicine in homeopathy. We have to consider the case as a whole, and considering the case as a whole, we need to prescribe a medicine to get a radical cure, to root out the disease in its whole extent. So that is that is our concept, that is holistic approach. So whatever may be the disease, whatever may be the pathology, so when we treat the patient, we have to treat as a holistic point of view, then only we will get success. Of course, in irreversible pathological changes, when the first observation of Kent is found, that means when the patient is in third stage or fourth stage of cancer, liver cirrhosis, in that case, where the vital force is very weak, in those cases we have to select pathological medicine, organopathic medicine, for example chelidonium, for example cyananthus, for example sabal cellulata. So these are the some medicine we need to prescribe, because our vital force is too weak, the dynamicity is too weak. But in curable cases, we must select medicine on the basis of holistic approach to get a good result, to establish highest ideal of cure. So this is holistic approach, that is the scientificity, that is the concept of homeopathy. Second point, that is individualization. So we have to consider every case as a new one. That's why in the selection of genus epidemicus for the treatment of epidemic disease, Dr. Hahnemann has clear advice: don't be prejudiced. If the cases is coming, then don't select genus epidemicus immediately. You collect symptoms from one patient, second patient, third patient. When the same symptoms will repeat, then you stop and select the genus epidemicus. So this is the advice of Hahnemann. So individualistic concept is the concept of homeopathy. We should not forget. So we have to individualize the patient, we have to individualize the medicine, we have to individualize the disease. So patient individualization is called anamnesis. Medicine individualization, by studying different medicine, there are so many similar medicines are there. In 246 aphorism, Dr. Hahnemann has clear mention that the physician must have to fulfill 3 conditions of cure. So we should have knowledge about 3 points of cure mentioned in 71 aphorism, and 3 conditions of cure mentioned in 246 aphorism. What are the 3 points of cure? The physician must have thorough knowledge about the disease, knowledge of disease in particular, knowledge of disease in individual. That means he must have thorough knowledge about diagnosis. What diagnosis helps you? So if we are potential diagnosis, the diagnosis helps us to manage the case. For example, we are suffering from diabetes, we are suffering from hypertension. In homeopathy, the knowledge of Sora cannot help us to give the idea that you restrict salt when the patient is suffering from hypertension. You cannot restrict sugar. That advice cannot be, you will not get in antisodic, antipsychotic or antisyphilitic diseases. But if we have thorough knowledge in diagnosis, then you can able to know the prognosis, we can able to manage the case by proper dietary advice. So thorough knowledge of diagnosis is required, that is individualization of disease, and that diagnosis knowledge helps us for prognose the case. So future forecasting of the case will be that knowledge will get from diagnosis. So the physician who has thorough knowledge in pathology, the physician who has thorough knowledge in practice of medicine, gynecology, surgery, then he will be able to know that whether the case is curable or the case comes under the jurisdiction of homeopathy or it is beyond our jurisdiction. If it is beyond our jurisdiction, we should not treat that case. We have to refer that case. For example, the diseases which are not originated from nature. If the disease has not originated from nature, then we have no scope at all, because our system is based on nature's law. For example, for poisoning, we have no medicine. To create abortion, we have no medicine. For accidental cases, we have no medicine because they are natural in origin. So homeopathic has a great scope where the origin is natural and limitation where the origin is unnatural. So we should know these things. So the first point, that is holistic approach. We have to consider the patient as a whole. In first aphorism, Dr. Hahnemann has mentioned the physician's high and only mission is to restore the sick to health, to cure as its term. So sick, we have to treat the sick, we have to treat the patient as a whole, not the part, not the organ, not the disease. So that should be our after our motto. So in this motto we have to treat the case. So first point, that is our concept of individualization. Second thing, holistic concept. Third, that is dynamic concept. So dynamic concept is the homeopathic concept. So that's why Dr. Stuart Close has mentioned in his chapter, that is schools of philosophy. There are three schools of philosophy are there: materialism, idealism and substantialism. Our homeopathy is based on substantialism. So we believe on dynamic concept written by Hahnemann in 11th aphorism footnote. What is dynamic? Dynamic means imperceptible. That is the nature of vital force, where there is no perceptible connection between source and effect. That is called dynamic. So for example, I am giving example of sorrow, anger. So these are some dynamic existence. So when I irritate someone else, he become irritated. You can't see, you can't measure, that the person is going to be irritated. 5 kg irritation is there, 2 meter irritation is there. So that cannot be measured. So the thing which cannot be measured, the thing which cannot be weighed, but which can be feel, that is called dynamic. So dynamic concept must be there, because our vital force is dynamic. If we will not treat the case by dynamic medicine, if we will treat the case by crude medicine, then it cannot affect our dynamic vital force. So radical cure cannot be taken place. So it will palliate. So dynamic medicine must be given. So dynamic medicine means potency medicine. So in 30 potency, 200 potency, there is no material quantity. That potency is aroused by means of potentization. So that medicine affect our vital force. That's why it has been clearly mentioned that the Hering's law of cure, the direction of cure, which is mentioned by Constantine Hering, the father of homeopathy of America, clearly mentioned that after administration of the medicine, the disease must be removed from above downward, from inward to outward, from more important organ to less important organ, in reverse order of their appearance. So this is the Hering's direction, and this direction is applicable not in material field. This direction is applicable in dynamic field. That's why when you give dynamic medicine, it affects our vital force. That's why it has been called that the primary action is the action of medicine on vital force. There are three dynamics in homeopathy. The three dynamics in homeopathy, they are vital dynamics, which are within us, which governs this material body, which role is to control, promote and preserve this material body. That is vital dynamics. So that vital dynamics is a centrifugal force. It operates from center to periphery as per the need. Second thing, the disease dynamics. So disease dynamics is present in disease force. So that disease dynamics, when it will be stronger than that of the vital dynamics, it invades, and it as we have studied, when two dissimilar diseases meets together, what happens? So the disease dynamics, it will overpower the vital dynamics and operate centrifugally again. Because of that, the vital operation which was normal, the tune of the vital force which was there in place, it disturbs, and the signs and symptoms, it appear as the disease process is there. That's why One is vital dynamics, which is present within us, which maintains or governs this material body, which establishes equilibrium between body, mind and vital force. They are the trinity of life. So soul, mind, body. So what our vital force does, it establishes equilibrium between mind and body. That's why the vital operation maintain, and we are maintaining healthy life. When that vital dynamics which governs our material body will overpower by the disease dynamics, then what happens? The vital operation disturb, abnormal signs and symptoms comes, and those abnormal signs and symptoms, when organized properly, that forms a portrait that is called disease. So what has been written in aphorism number 6? So the physician must have to form the portrait, and that portrait accordingly the simillimum is administered. So to select a simillimum, that is the first condition of cure. The first condition of cure, that is you must have to select simillimum, and that simillimum must have to administer in proper dose and potency. That proper dose and potency must be selected on the basis of susceptibility. Then not only simillimum, not only dose and potency, again that medicine must be repeated in proper interval as per the condition of the patient, as per the condition of the disease, nature of the disease, as per the nature of the medicine. So when these three conditions will be fulfilled, then you will get radical cure. So that knowledge every physician must be there. Then only he will establish a radical cure. Then the again dynamic concept, of course the the modern science is not accepting, but they know about the physiology, they know about the constituent of the body, they know the how much iron, how much copper, how much different elements are present in the material body. If we provide all the constituent of the material body in proper potation, proper way, they cannot form the living organism. So the living organism without the vital force is dead. The living organism, which is made up of 5 pro elements. So there are 5 pro elements, and when the vital force will go out of our body, then this material body will be supposed to destroy by different physical and chemical forces, and again converted into its 5 pro elements. So this is the proof that there is a superior power which governs this material body. Without that spiritual power, without that vital force, the material body is dead. It will not possess any type of action. It will support to destroy, decompose. So we have to accept it. Second thing, already if you go through the Dhawale philosophy, the Emil Dhawale philosophy, he has clearly written that when the zygote is formed, what happens? From the cosmic vital principle, the vital force entered inside the zygote, and it operates centrifugally during cell division. It provides energy to different group of cells to solve a particular purpose in future. A group of cell becomes brain, a group of cell becomes kidney. So the energy is supplied in which is called by Kent, that is called influx. So the influx of forces that is provided to the group of cell centrifugally, and when the energy is supplied to different group of cell in proper manner, then proper development occurs. What happens when that flow of energy, influx of forces are disturbed, obstacle by any cause, that may be constitutional, that may be miasmatic? What happens? The proper organ, either that proper organ, kidney, brain, lungs, will get more than expected energy, so that part becomes hypersensitive. When that part becomes hypersensitive, that condition mentioned by Hahnemann in 117 aphorism, that is idiosyncratic. So that person becomes more idiosyncratic and becomes hypersensitive. So that is a developmental defect, morphological imbalance. So The physician must know the scientific part. Second thing, if the supply of energy by the vital principle is less than required, then the organ can't develop, will be not developed in proper manner, so it will leads to hereditary dyscrasia. So this is the concept of,
Okay, sir.
of dynamic force.
Okay, sir. It's a really a very good session indeed. Even though you were asked to talk for some time, but you were able to complete the session fully. That's a very good point of gesture from you to take this forum in a brilliant session. Congratulations, sir. Anyway, it is the time for discussion. As you all know, homeopathy is based on some principles and laws which everyone should follow. And we used to say that homeopathy is a science which is the perfect science. And why it is a perfect science? Because we have the philosophy, and it is a never-changing philosophy. That's the only science. That's the reason why we say it's the pure science. And as sir told, sir has presented so many cases, and how one can identify quickly, how can reach the simulum in the shortest possible time, and how one can select the potency as per the patient, as sir has pointed out here that it is in reverse to the age. That means that if the child is, if you get a child with a perfect clinical picture, you can go with high potency. And if the patient is a very old person, and the susceptibility is very less, and in those conditions you can go take a short low potencies. And that's the reason why even people used to give tinctures during old ages as well as advanced pathological cases. So knowing all kind of prescriptions, one need to understand, one needs to read organon of medicine every now and then, and to know what to do when you have, there are certain you may find some obstacles in the way of cure. And so what are the obstacles that come in the way, and then how to move forward. Then, you will get answer from our organon of medicine if you go through and study it in a very well way. And every time when you read, you will get something more and more. When you read organon, you will have to read the as the so-called NB, that means the points written in the very small letters. So that need to be read. Otherwise, Heinemann giving much explanation to each and every aphorisms in a better way in that way. Anyway, Dr. Ambaresh sir, you want to say something more? You can say your idea on that, because sir has presented so many cases here. And
thank you, Dr. Thanesh ji. And today the guest, Dr. Urmila, is absent and describe the homeopathic philosophy. Dr. BIBHU Prasad Panda ji, very congratulations. Wonderful describe the homeopathic philosophy. And concept of homeopathy. Homeopathy is a really your science and art. Collection of symptoms, it is art, and select of remedy according to homeopathic philosophy, according to Dr. Kent and Dr. Herring. It is science. Really science. Homeopathic is a science. And describe the approaching 11. Dr. Panda sir, I am agree. जो 11 approaching 11 यानी dynamic cause of disease, dynamic concept of individualization, concept of dynamization, concept of holistic, है ना? तो main cause of disease according to law of homeopathic science is a dynamic in individual. तो बीमारी मेन कॉज, बीमारी का कॉज डायनेमिक, एंजाइटी, नेगेटिव थिंकिंग, फियर, ग्रीफ, इंसल्टी, इट इज डायनेमिक. cause is dynamic, and vital force, yani life force, is a dynamic. And जो है medicine, homeopathic
Okay, sir.
medicine is a dynamic. Very good describe the today's session, wonderful test session. Very, very thanks, Dr. Panda sir. Thank you.
I'm inviting Dr. Binoy to say vote of thanks to the session. Dr. Binoy? Yes.
Yes. Can you hear me?
Yes, yes.
Yes. I attended the session and it was a very, very enlightening, wonderful session on the philosophy of homeopathy. And Dr. Pandaji explained it very well, and it was like with experience and from your heart it explained. And I'm sure it helps all our practitioners and homeopathy lovers and those who experience the effect of homeopathy and the healing. And it should be a very reference. We should be able to reference your session and should be able to prescribe and help. Thank you very much from a IFPH standpoint and all the participants standpoint. Thank you very much, Dr. BIBHU Pandaji. Thank you very much.
Thank you very much, sir. No,
Thank you, Dr. Binoy, Dr. Ramaresa sir, and the guest of the day, Dr. BIBHU Kumar Pandey sir. As we know that today it was a day for Dr. Urmila Pandey, but she couldn't attend the session due to some technical problem with her laptop. And thank you all the people who joined the session. And tomorrow we will have a session from Dr. Charanjit Singh. Sir is the professor at Department of Veterinary Medical, and he's from Rajasthan and is the Dean and Faculty of Homeopathy, Tania University, Sri Gangadhar, and is the former principal of Sri Gangadhar Homeopathic Medical College, and will be talking about miasmatic understanding pathology. Thank you all. Good night.
nice, sir.
Dr. Hariam sir is a present. Namaskar.
Also, Dr. P. Shailat in Malayalam session.